Thank you for making time for our active listening and effective communication series. And so, once again, thank you for joining us. Let's talk a little bit about some of the do's and don'ts in active listening, right? And with this, there are going to be a lot of things that are not going to be absolute, but it's been written in an absolute sense. So I'll break them down, I would explain the nuances in those things. So uh, give your full undivided attention. If you're talking to someone and someone is telling you something that is really important to them, you want to demonstrate to this individual that you are not just going to do whatever you're doing and try to listen to them where you're not paying full attention to them. So this helps that individual to feel safe, to feel like you do care and you are ready to listen and help them to navigate whatever challenge that they are bringing to you. Put away your phone and close your laptop during sessions. This is in a situation where you are physically in front of the person or it's a physical interaction. If you happen to be using your phone to communicate with the person, you don't put it down. And also, if you happen to be on a Zoom call, you don't shut your laptop. So these are going to be some of the situations it wouldn't work the way they've written it, right? So, for instance, if you use technology to communicate, it's important to highlight that you are going to have this here or have this device here and it does this, and sometimes it might distract you. So you let the individual know if that is something that is a must, you must have. If you don't need it, then please put it away. Make appropriate eye contact. This is subjective, right? It's not absolute. It's not every culture that eye contact is a sign of you telling the truth. Yeah, certain cultures, you making eye contact might actually be taken out of context or may be taken in a different way. So it's important to also understand the culture in which you are communicating to know what will be best and what wouldn't be acceptable. Show empathy through your words and your body language. Like we talked about earlier, empathy is not just is not the same as sympathy, right? And also, empathy is not you assuming certain things. Empathy is understanding the individual, their feelings, and where they are coming from. So, creating that space for that individual to tell you their story based on their experience and not based on your experience or based on your assumed experience. It's really, really important to understand the difference. Sometimes our body language could show that we are not showing empathy or we are not empathic. For instance, someone might be telling you a sad story and you would have a face that is smiling, or you'll be laughing at something else. It doesn't show empathy. So making sure that your body language is congruent to what is being what you're being told is very, very important. Allow silence when your client needs time to think. Um, we are always not going to be in a position where we expect the person to tell us like rapidly, and if they don't, then it means either they're lying or the story doesn't make sense. Sometimes an individual might be going through a lot of emotional issues, and they might be overwhelmed. So the silence allow them to regroup or reorganize or readjust, so they are able to really tell you the story as it should be told. It doesn't mean that they are lying, because there are certain there are certain times people feel like when someone is silent, it means that they are now creating the story in their head. That is not always true. Silence is a therapeutic tool. Sometimes a therapist will create the space for silence, because a lot of people have been brought up not to be comfortable with silence. And because of that, they do not learn to use that tool therapeutically to actually help them. So, learning how to feel comfortable in a quiet environment or in silence actually also helps. Ask for clarification when confused. This is so important. When you are doing active listening, one of the things that you always try to avoid is assuming things without having the right information to back your assumptions, right? So asking clarifying questions are so important. And it's also important how you ask these clarifying questions. You do not ask them in a way that it makes it psychologically unsafe for the individual. It is important you ask it in a very caring, empathic manner. You are able to say, so from what I'm hearing, this is what I'm taking out of it. And I want to ask clarifying questions if my thoughts are accurate. When you put it like that, that individual knows that you are not assuming this or that and putting it on them. You are using what they've said, but there are parts you do not understand and you want them to clarify. So it's really important for you to approach it that way. Reflect what you hear to confirm your understanding. Reflection is a key tool. And like we said, you could reflect to the content of what is told, and you could also reflect to the emotions. So always remember there are two kinds of reflection: reflecting to the content, where you tell the individual what they've told you directly, and then also reflecting to the emotions is where you respond back and you highlight the emotions that this individual is carrying based on what they've communicated to you. Be aware of cultural communication differences. Like I was saying, there are certain cultures, they do things, they communicate differently. We are going to talk about some of those as we go, but it is really important to understand these cultural differences, so you do not assume or you do not make mistakes or you do not read a wrong meaning into someone's communication. Take brief notes if it helps. This is in situations where you are doing a lot and you are to see multiple customers each day. It becomes difficult to remember everything everyone said. So taking notes is going to be key. It's going to be important. What you are able to do in this situation is ask for permission. Hey, sir, is it okay if I take some notes? It's going to be brief. It's not going to be that much. This will help me so that I'm able to document or report or find the right help for you, because I'm not able to keep everything in my head. And also, you are able to assure them this I'm writing. it stays here. I'm not going to basically post it anywhere or share it anywhere. Or you are able to explain to them if there's a policy around that particular how we navigate documents. You are able to explain to this individual, hey, I'm going to take little notes here and there, but it's just for me. It's so that I'm able to do my report. That person will feel comfortable and safe to basically allow you to um, uh, uh, take that note. The don'ts: interrupting a client mid sentence. Don't do that. It comes off as rude. It comes off as you are displacing them, you do not regard them, or you're not interested in listening to their story or their pain or what you're going through. So don't interrupt people when they are telling you their story or when you've asked them a question and they are trying to answer. Rush to fill every silence, like we talked. When the person is quiet and you are quiet, you feel like, oh, you need to say something. No, it's a therapeutic tool, and sometimes that is what is needed so that that individual is able to catch their breath, that individual is able to think through what they've talked about, that individual is able to adjust their emotions. So there are so many uses for silence. So don't try to fill every time that there's silence. Think about your response while they are talking. Like we talked about the last session, that don't try to um, uh, look for answers immediately someone starts talking. The goal is for you to understand them and to demonstrate to them your understanding. And if you need to ask clarifying questions, you do before you give them answers. Don't jump to providing answers when you've not understood everything going on with the individual or what they want to get across. Make assumptions about what they mean. If you're assuming something and you're not sure, that is when you actually use clarification. Ask for clarity. Tell them what you've heard so far and what meaning you started making, but then where you have a gap and you need them to help you make sense of it. It's really, really important. Without you doing that, you assume, and you could assume wrongly, and it will be the thing that creates a situation where that individual does not trust you. Don't minimize anyone's feeling or generalize. Oh, we all experience that. Oh, that's not too bad. These are some examples. Oh, everybody goes through that hardship. Oh, you will be fine. Don't do that. These are things that create a scenario where that individual feels like I I came to you for help, but then you displaced what I told you and it seems trivial to you. Next time, if I'm going through an issue, I'm not going to feel comfortable telling you because I know you're going to play it down. Also, it's really important not to offer unsolicited advice. And I would explain. Unsolicited advice in the sense that if you do not understand what this individual is going through, you've not really paid them the attention they need, asked clarifying questions, paraphrased, summarized, done all the steps in active listening, don't give them any advice because you do not understand where they are coming from. Clearly, your advice might be something you may have encountered, but their story might be different from yours. So don't, until you've understood every little bit of what they are telling you and you've checked in with them. And even with that, there are so many different tools and strategies you are able to use without providing them advice. Advice comes in after you've really worked with them for a while and you've gained trust and you also understand their um, uh, 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 concept of life, their priorities, and understand their what's the word to use here? Their values, right? You understand their values, then you are able to provide advice. Advice in clinical setting is something that you do very, very minimally. You hardly do that because if you are to provide advice to a client and they do what you've provided and it doesn't go well, it opens you up for litigation. They could sue you because you gave them advice. But if it's in a clinical setting and you use a therapeutic approach and you probed and you understood and you used the information they provided you to help them to make a decision, that is not advice. That is you doing clinical work. That is you explaining or you helping them to get to that answer. So you did not make the decision for them. You did not push them to, or you did not make any assumptions of what could help them. You both work through to get to that decision. So the other thing too you don't do is make the session about you by sharing your story too much, where the attention is away from the individual and onto you. You telling them your story and your experiences when they've not really told you everything makes it seem like they are talking to you about you more than they're talking to you about them. So it is really, really important that even if you've experienced something similar, to wait for the right time to bring that in, not to share right from the beginning or when you've not really understood the whole story of they've not finished telling you the story. Judge or criticize their choices. It's really, really important not to do that. Uh, like, don't, don't criticize. Oh, but why did you do that? But this is common sense. Like, I wouldn't do that. Don't do that. Don't make that person feel psychologically unsafe. Don't make them feel small. Don't make them feel like they've messed up. If your goal is to create a space where that individual wants to trust you. I'm not saying don't do these things at all. There are times you these are going to be good things to do, but right at the beginning of establishing your relationships or demonstrating your understanding of good communications, don't do these things. The other one is self explanatory. Check your watch or your phone during a conversation or a session with someone. Don't do these things. It really, really, really sends a wrong message. Let's talk a little bit about effective communication. When we talk about effective communications, these are the main principles that makes communication effective. Clarity, empathy, respect, and authenticity. So I'll go one after the other and explain why these things are so important in effective communication. And this should be something as a team we live by. Because if we are able to embrace these things, I will tell you this, there's nowhere we are not able to succeed. And there's no one we are not going to be able to bring in or convince to work with us. Right. Clarity, as simple as it is a very, very important tool, right? If you're talking to someone and you're not very clear and you have limited time with that individual, they write you off because they find it that either you're being evasive or there's something you're hiding or you have an ulterior motive. So, learning to be upfront, straightforward, be very clear in what you want from someone is going to be key. And especially in our field of work, we are going to have a lot of people reach out. Everybody, different educational level, different communication levels are going to be reaching out to us. We need to find a way to break down concept into easily consumed information for everyone. We are not only catering to one particular population over the other. Our goal is to get information out. So avoiding jargons or avoiding very complex words or vocabularies, sometimes depending on who you're talking to, is going to be key. And quite often we are able to pick up some of these things right from the get go, right? Based on how someone would respond, like initiate the conversation, you know. And then also you're able to adjust, right? The same way you don't want to uh, use jargons and complex explanation, there are going to be certain people who immediately, if you've broken it down too much, they would let you know that they are a little bit more sophisticated. So you adjust and you're able to use the right terminology, the words to help them navigate. So clarity, very, very important in our setting to be very clear and make sure that the other person understands us. We are not creating a space where they cannot ask for clarity if there's something that they are not sure of. Number two, empathy. Empathy has been a lot of people explain empathy in different ways that sometimes I listen and I go like, oh no, like no. Empathy is not you trying to fit into someone's shoes. You can never fit in another person's shoes because you've not been through the issues they've been through. You've not experienced what they are experiencing. You may experience similar, but it's not the same. So if we use the term trying to fit into someone's shoes, we actually are getting empathy a little wrong. We need to be in a position where we actually understand the individual and the experiences they are going through. So, because if they are going through something and their upbringing is also different and their environment is also different, we need to understand all those aspects for us to be empathic. Just understanding that they're going through this and we saying, oh, we've also been through that, is an equation is not true. Because yes, maybe we are all experiencing similar challenges, but then the other person may have experiences or certain elements they are able to leverage that makes their experience more tolerable or more manageable than the other person. So clearly, you trying to fit yourself in their shoes based on your experience is never going to be the same. So trying to understand their experiences and what they're going through is key, right? So not using our experiences to make sense of that individual's what that individual is going through. So always remember that. Three, respect. No matter how someone tells a story, um, we are able to create a situation where we respect that individual's autonomy, their values, their decision making, even though it may not be in line with what we are used to or what we feel is the right thing to do. We can respect people's differences, difference in their opinions, and still be able to help them. So, and these are part of what sets you up as you begin to do provide therapeutic help, right? Because uh, if I am to immediately dismiss or put someone down and not respect their values and their decisions and their autonomy, then right from the get go, as I begin to work with them in therapy, what happens is I'm going to basically try to make them fit into my concept, and that would actually create harm to that individual. So it is important to respect it. The fact that you respect someone's autonomy or values does not mean you agree to it, right? I respect you made this decision. It doesn't mean I agree to it. You just respect that they had the option and that was what they chose. And if they work with you and they explain that it's a problem for them, then you work with them to get that problem solved. If they are not telling you it's a problem, then there's nothing to be done there. Even if that is where they are, that what we call the pathology, the issue is. If they've not got themselves there, it's going to be part of your treatment plan to get them to that point where they begin to see that that is the issue. But until then, you are not able to displace them. You are not able to say, oh, this individual is did this and that is, excuse my friend, that is stupid or that is not sensible. So then you're not going to help them. So respecting people's autonomy, their values, their decision making capacity is really, really important, even when you might disagree. Working with them through that is going to be where a lot of the heavy lifting is done. Authenticity, be genuine in your response. Make sure that you are letting the person know that you are not here to judge. You are not here to make them feel small. You're not here to make yourself better than them. You're here to work with them and to find a solution to their problem. So, really, really important.
Yeah.
Let's move on to our next one, cultural considerations in Ghana. In a uh, communication sense, even as we were talking about active listening, in the Ghanaian culture, there are so many nuances that are important for us to have in the back of our minds as we communicate. Respect for hierarchy and age. In Ghana, even the way we are interact or navigate life, right? Uh, the old way, like someone is older than you, like even 3 months, they want you to call them brother or sister. Church, someone is older than you or aunt. Everybody is an aunt. Everybody is a sister. The way you address people, if they are older than you, because that is how our culture is set up. Things are changing now, but still, we want to really hone in on some of these things. It is important to understand if we are working with people and they're reaching out to us and we assume they are a little older than us, it's important to create that dynamics so that that individual feels respected, feels like you respect that hierarchy and you're going to treat them with that level of respect, right? It doesn't mean that you are going to give them everything they want. It doesn't also mean that you are going to give them something that they shouldn't get. It just means that you're creating this space for them to feel comfortable based on that cultural context, right? Um, a lot of times we've also seen where someone is not acting their age. Doesn't matter. In our setting, creating the space where we value some of these things are going to be key. There's a way to navigate such challenges. And over time, as we continue with this, we will be talking about some of those down the road where someone's chronological age and their psychological age are not at par and how to navigate those two, right? Where you are, you do not treat them with disrespect, but at the same time, to you provide them with what they need. Indirect communication. This is a very, 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 very important thing, and I included this one because it's a big challenge we experience in Ghana a lot. Um, People struggle talking about difficult things, and sometimes when certain things are very difficult for them, they would dance around the topic or insinuate or um, do a whole lot of different things other than talk about that particular thing. So if you know and understand some of these cultural considerations, then you are also able to create the space that helps this individual to work through some of those things to be able to get them to a place you are able to do some of the heavy lifting with them. So some of them would give you hints, some of them would tell you the opposite, or some of them would attribute those things to other people, would project it to others. They would make indirect statements. So listening and then working through that with that individual, sometimes it's just going to boil down to really doing a deep dive to understand their fears around that particular thing and helping to remove that fear. Once you remove that fear, that individual begins to feel comfortable telling you exactly what it is that they wanted to tell you. Family and community context. These are also very, very important in the Ghanaian culture, family is everything. And also, if they belong to a particular community, be it their church, their area organization, their affiliations, so on and so forth. Understanding them in this context is really, really important because then it positions you in a very good place to navigate some of the problems because you find out that if they are coming from a culture or a context where these things are really strong, they are some of their problems are also going to be coming from there, or some of the reasons why they've not been able to find a solution to those problems are because they are struggling navigating that complexity. So working with them through that is going to be key. Spiritual and religious beliefs, very, 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 very key, right? We could do a whole webinar on this, especially when we talk about Ghana. Ghana, spirituality and the religious beliefs are kind of impact us in so many different ways. The way we work, the way we interact with people, the way we our carry our lives together. Whatever we do, these are some of the things that guide us. So if you're working with someone, it's important we understand some of these things and create a space where we demonstrate to that individual we understand and respect it. If it is part of the reason why they are having the issues, we have to be very delicate and navigate helping them in that sense so that we do not create more problems for them or we do not put them in a situation where that becomes the pathology, right? So some of the best practice here is when in doubt, ask the client about their preference. How would you like me to address you? Or what feels the most comfortable for you, right? Show that you respect their culture, you respect where they are coming from. And quite often, too, you find out that a lot of people do not really understand the culture. They've just had things and they've taken it up. So, working with them helps them to go learn even more. And then also, you are able to help correct some of the misconceptions they've put in their heads about their cultures and their religions. Thank you, everyone, for joining.